Hello everyone, I'm Jan Marini, the founder of Jan Marini Skin Research. I'm here with David, and David is here for a consultation. David is an engineering manager, and so I'm going to ask him a few questions. So if there was something you could change or improve about your skin, what would it be?
Well, I think probably the brown spots. That's really coming from just being outside and just outdoor activities.
Okay, anything else?
A little puffiness in the eyes. I think that's more hereditary.
Anything else besides puffiness?
No, that's about it.
Okay. And you don't have any adult acne or anything like that?
No, I don't think so.
Kind of you like the texture of your skin, that's good as well?
Mm-hmm.
Okay, good. And let me ask you what your skin type you think it is. Do you think it's more normal? Do you think it's a combination? Do you think it's oily, dry?
It's more on the oily side.
Okay. And are you oily everywhere?
Yeah, pretty much.
Do you get really shiny on the cheek area or just in the T-zone?
I would say forehead. Well, I would say almost everywhere.
Everywhere. And do you feel like it's oily to the point where you look in the mirror or you happen to see yourself during the day and you feel like, wow, I'm noticeably oily?
No, I wouldn't say so.
Okay. What was your skin like as a teenager? Do you have any acne?
Yes, I did.
Okay.
Yes, I did.
And did you have it pretty much all over in the certain areas?
Let's see, if my recollection, it was mostly in the jaw area.
Okay. And do you recall, did you get papules that turned into pustules, or did you actually get those nodules and cysts?
Describe that a little bit more.
Well, typically, sometimes people get red papules, like red bumps, and they turn into pustules.
Okay.
And then other times you get those, what we call those underground lesions that are nodules, and sometimes you just get these big full-blown cysts. They don't usually come to a head.
Okay.
They're the kind that scar, they hang around for a long time, hard to get rid of.
I think they were red, if I remember right. But, yeah, my dermatologist basically said, just don't put your hand there.
Oh. Okay. And how old were you when the acne subsided? Do you remember?
I think that was probably after high school.
Okay. So the reason I asked that question is that men usually don't have acne past the age of 23. And that's when you get terminal beard growth. Beard pushes everything out of the follicle. We females, we can have acne the rest of our life if we have a tendency toward it. And there also, when I questioned David about his oiliness, a lot of times people will say, well, I'm oily. And then if you say, are you oily all over, they'll say, I'm oily in the T-zone. So if you treat them as an all-over oily skin, then you can actually cause more dryness. And so I would say that David's probably maybe moderately oily, and we'll kind of figure out whether you should be treated more oily or combination. So tell me, what do you wash with, if anything, in the morning?
Just soap and water.
Okay. Any particular kind of soap?
Just hand soap.
Pardon?
Just hand soap.
Okay, just hand soap, anything that's around. And anything that you do after that? Any moisturizer, sunscreen?
Sunscreen.
Okay, and what, you know what brand it is?
Let's see, if you use Jan Marini.
Okay, so you've used the Jan Marini brand, okay.
The other one was a Thomas Roth.
Okay, or Peter Thomas Roth. And the one that you used from us, I'm pretty sure was probably the SPF 33.
Probably.
Because kind of, it's not tinted, it's just a kind of a creamy looking sunscreen. Okay.
Not heavy.
Okay. Did you notice when you used the SPF 33, the JMSR SPF 33, did it limit the oil or make your skin feel a little less oily?
I didn't feel any oiliness.
Okay. And then at night, do you do the same thing? Just soap and water?
Yep, just like
Okay. Or do you wash at night? Because a lot of guys don't.
I do.
I ask that question because, you know, a lot of times guys kind of look at you strangely if you say, do you wash at night? Because, you know, you shave in the morning and then pretty much you're done for the day. But some people do wash at night, so. And anything that you put on afterwards?
No.
Okay. Do you ever do anything on an occasional basis, like any kind of a scrub or a mask?
No.
Okay. Okay. So let's talk first of all about the brown spots.
Mm-hmm.
When did you first notice that you had discoloration? You were starting to get discoloration?
I would say probably in my 40s.
Okay, so most of the damage that we're going to see in our lifetime, and you look in the mirror and you start to see things like brown spots, or you see lines and wrinkles, or you mentioned puffiness under your eyes, and there's just this assumption like, well, you got to get old. Everybody's going to get old no matter what you do, and it's just inevitable. But most of that damage was programmed into your skin before the age of 10. And 50% by the age of 20 at least. And it just takes 10, 20, 30 years to show up. So many times people look at their faces in the mirror and they think, wow, I really haven't aged between, let's say, the age of 20 and 30. Then all of a sudden, 35, 40, all of these things just suddenly start to appear. And from then, it's downhill. We're going to fix that though. It's a cascading effect. So the brown spots most likely have to do with sun damage. And also, it has to do to some extent with ethnicity, because if you have more pigment in your skin, then you have a greater tendency to react to the sun. And some people, like for example, you've heard me say this before, I've got issues with my skin, but discoloration on my face is not one of them. Even with incidental sun exposure, I've just never had that issue. I do have more of that issue on my chest or maybe on my arms, places like that, but not on my face. And other individuals can sit in a hot car and all of a sudden they pigment. There are people sometimes who work around in factories around very hot ovens. That can cause them to pigment. And it's very easy for their pigmentation to be triggered. So we'll get more into that. And then with regard to the puffiness underneath your eyes, that's a whole other issue. So you're right, and to some extent it's hereditary, but hereditary from the standpoint of how your face is structured, but everybody has a fat pad that kind of is around that orbicularis area. And that fat pad is held back with skin and membrane, so it kind of acts like a girdle, and that's what sort of gives that eye area contour and keeps that fat from protruding. Now as time goes on, and this is due to sun exposure and the aging process, but primarily sun exposure, the skin underneath the eye weakens, and that skin tends to be thinner. You don't have oil glands there, it's just more vulnerable to sun exposure. The eye area is one of the areas that tend to show age first. And so when that girdle weakens, the fat begins to herniate. It pushes out. Now, there are things we can do to kind of minimize that and just sort of make that eye area look more contoured. And when it first starts to herniate, what happens is fat retains water. So you get up in the morning, your eyes look puffier than usual, but then sometimes by 11 o'clock or noon or whatever, you feel like, okay, it's less puffy. But then as time goes on, you say, I'm still puffy at 1 o'clock, I'm still puffy at 2 o'clock. And so it starts to become more of a permanent all-day kind of a situation. So again, there are things that we can do to minimize that. Now, if you really want to take care of it, I'm not suggesting that you run out to your favorite plastic surgeon or ophthalmologist, surgical ophthalmologist, but there's a couple of things that they do. One is where they remove the fat conjunctivally. Now this sounds really horrible, but it's a very easy operation. They actually pull the eyelid down and they make a bloodless incision and they pull the fat out. It looks like a little sack of grapes. And the skin actually tightens and contours, recontours. Now if you had a lot of excess skin, then typically they make an incision at the lash line and they probably remove excess skin. And as opposed today to removing fat, a lot of doctors actually recontour it or use it and kind of roll it up, so to speak, or reposition it. Because if you look at a very youthful face, it's not hollow underneath the eye area. It's just that the distance from here to here is shorter. so that you don't have that puffiness and that you have a nice contour. So just realistically, to understand what we can do topically and what is actually cosmetic surgery. But again, sometimes you can make a noticeable difference. And there are certain things that can actually increase the circulation in the eye area so that the water retention isn't as obvious. There's things that we can do that can make dark circles less noticeable, because as we get older, even if we don't have a tendency genetically to dark circles, the blood vessels are more compromised, and so that area just isn't as light and bright. So there are definitely some things that we can do. Now, with regard to the brown spots, so typically there are a number of things that we do for discoloration. The most common thing is that we use something called tyrosinase inhibitors. Tyrosinase inhibitors are ingredients that help to limit how pigment is thrown off. And so they're oftentimes called lighteners. And probably the best known tyrosinase inhibitor literally in the world is hydroquinone, prescription hydroquinone. Now, have you ever used anything like that before?
I don't think so.
Okay. Well, prescription hydroquinone is very controversial because while it is used extensively in the medical community, a lot of doctors would prefer to have an alternative. There's some side effects with hydroquinone. It's actually not available in a lot of parts of the world because of the side effects, such as sometimes with continued use with higher percentages, it can cause something called blue-black pigment, and it's permanent, and it's just like it sounds, blue-black pigment. So the problem is that people want to address their pigment, and physicians want to make their patients happy. So if they don't have a really good alternative to hydroquinone, that's typically what is recommended. But again, it's just controversial. There are other tyrosinase inhibitors that can actually be pretty comparable to hydroquinone in terms of the appearance of pigment. And I work with lots of different tyrosinase inhibitors that work very well to inhibit the appearance of the pigment. But there's another issue that really makes a difference as to how you pigment. And that has to do with the hormone that we all have. We all have a hormone that floats around in our body, and pretty much all have the same amount. So you could be a redhead with freckles that goes in the sun, always burns, never tans, and you have the same amount as someone else who has a darker complexion. Now, women do have more of it if they're on birth control pills and more of it if they're pregnant, which is one of the reasons why you tend to see more pigmentation in pregnancy. But we all have it, and genetically can play a role of how you react to the environment, why you may have more pigment than somebody else. And so being able to address that factor is absolutely key, and that's something that's a relatively new area. The other thing is that we now work with something called turmeric. Turmeric has been used in India for years, for centuries, by women, and it's such a powerful tyrosinase inhibitor that if a female would put it on her skin, let's say 4 or 5 days before going to a wedding, that her skin would actually be lighter and brighter and the discoloration would be lightened. But the whole time she's wearing it, her skin is bright yellow. Now, companies have used turmeric extract and turmeric root, which is very weak aspects of the chemical and doesn't really do a whole lot. But for the first time, we've been able to take the active ingredient and make it colorless. And it's also great for the appearance of aging. It's great for the appearance of inflammation and some of the triggers that have to do with discoloration, but it is tremendous for the appearance of discoloration. Tremendous ingredient. So we're going to be working with you on that. Now, the other thing is, I think that what I'm going to do is I'm going to put David on a very targeted program, because typically if I'm working with somebody that's just been using soap and water and a sunscreen, to load them down with 4 or 5 or 6 products is kind of demotivating. And there's this tendency to kind of feel defeated before you start, because you're just thinking, oh my God, is this going to take so much time, even if it's only something that takes 2 or 3 minutes. So what we want to do is we always want to focus on what is it that somebody wants to change or improve. We can always expand on the program, but to really be able to get a terrific result for your concerns, and your concern's pretty narrow, we don't have to do a whole lot of products. So what I'm going to recommend is I'm going to recommend our bioglycolic oily skin cleansing gel. And this is actually kind of the cousin of our basic bioglycolic cleanser, which I've talked about in most of these consultation sessions. The difference is this is essentially the same amount of glycolic acid. It's the same type of cleansing. It's just in a gel formula, and it is for oily skin. Oily skin, it's not just that oily skin produces more oil. Oftentimes the oil is actually thicker. So to cut through, for somebody to feel like their skin is kind of normal after cleansing, they need something that's going to be able to be a little bit more of a degreasing agent. We don't want to dry skin out. Now the other thing though that you're going to love about this cleanser is that even if you're using the best soap in the world or the best cleanser, and I make cleansers that are not glycolic acid, they're very superficial. Glycolic acid is a small molecule that can actually get into your follicle. So if you have any follicular retention, anything that gives you large follicles, the kinds of issues that cause you to have acne as a teenager, it actually can get in there and help to address some of those issues. And it just makes the skin feel smoother, it makes it feel softer, and you can actually shave with it. So it's a really great product. So the bioglycolic oily skin cleanser. And then I'm going to have you use our Luminant face lotion. Now, not only does it have all of the attributes that I talked about, but it also has retinol. Of all of the ingredients that are documented from a medical perspective, there's more research on retinols or products that have retinoic acid or retinol, and glycolic acid has more validation and more research than virtually any other ingredient. I'm talking years and years of research. So this is something that for the appearance of aging, besides just the discoloration, is going to make a huge difference overall in your skin.
Cool.
And then I'm going to have you use the Luminant Eye Gel. And hopefully that's going to make a difference in the appearance of that eye area. And finally, something that you're already using I am going to have you use, this is going to be very, very light. I'm going to recommend to you our Hyaluronic 3D. I'm recommending this for a couple of reasons. One is because it is so light, it disappears into the skin, and you're not going to feel like you have anything on your skin. So as we get into the hotter summer months, because right now we're in June, almost July, your skin is going to probably get more oily. And this is a product that's going to give lots of hydration, but it's not going to feel like you have anything on your skin. As much as 50% of what we perceive of aging is loss of volume. So if you look at skin, and volume primarily is hyaluronic acid. And let me kind of back up. The common denominator in aging among all species, and it doesn't matter whether it's a human being, a horse, or a cat, or a bug, is loss of connective tissue. So connective tissue, of which one of the primary components is hyaluronic acid, makes you fluffy. And you know, when you talk about aging, don't you hear the term sometimes little old people?
Yeah.
It's because they don't just get old, but they shrink.
Yeah.
And so we talk about them as little old people. And that's loss of connective tissue. And it's not just loss of bone mass, but when a baby is born, there's a huge amount of hyaluronic acid. It absorbs about 1 to 10,000 times its weight in water. So it's not that babies are really fat, but they're just full of hyaluronic acid. As we age, and as we get in, particularly in our 20s and beyond, we lose significant amounts. We don't produce as much. And particularly in the face, when you look at a person as they age, particularly females, their cheek pads are up here, and then at some point they start to flatten out. And actually men have the same issue, but in a man, when that happens, they become more masculinized in facial appearance. When it happens in women, they become more masculinized in facial appearance. Another saying that you may have heard is that as people live together for years and years, they say, oh, they start to look alike. It's because the woman starts to look like the man. So volume is really important for making the skin look plump and look youthful. And this is something that is really a game changer. Normally, hyaluronic acid in products is a great moisturizer, but it just sits on the surface of the skin, and it can actually absorb, again, 1 to 10,000 times its weight in water. So instead of keeping water from evaporating, it actually can make the skin more hydrated, but goes away very quickly. These are tiny little molecules that actually get into the skin. And it doesn't replace hyaluronic acid injectables. But the reason hyaluronic acid injectables, you've heard of people that get, injectables for their lines and wrinkles. Well, it's not the hyaluronic acid. What it does is it creates a framework for collagen. Collagen fills in, and that determines the lessening of that line or wrinkle or defect. And how long it lasts depends on how much movement you have in that area or how cross-linked the product is. When we can get these little molecules into the skin, and you're using it day and night, they also can form a framework for greater hydration, for the appearance of volumization. And so it's true moisturization. And that's something that as time goes on, you're going to really appreciate because it's going to keep your skin looking a lot more youthful. So, and you're going to just love the texture because most things make your skin feel more oily if you use a so-called moisturizer. And I'm going to continue on having you use the SPF 33. Now, the SPF 33 is really great for David because in addition to being a sunscreen that has the highest rating that you can give a sunscreen in terms of its protection for UVA and UVB, because sunscreens are over-the-counter drugs, they're regulated by the FDA. This also has an oil capture system that has an unlimited capacity for oil absorption. It doesn't absorb water and it cannot absorb the actives, but it can make a huge difference in how oily you are compared to other sunscreens. So that pretty much completes your program. Now, there's some things that I'm going to recommend for you probably for the future once you kind of get acclimated onto this. Do you have any questions for me?
No, sounds good.
Great. Well, we're going to continue to work with you. And one of the things that I always say is that even if you told me a month or 2 months from now, wow, Jen, my skin is the best it's ever been, it's the best it's ever looked, we can actually make it better.
Good.
So I'm going to check back with you. Someone's going to check back with you in about 4 days. I'm going to check back with you in about 2 weeks and then another 2 weeks after that. We may need to adjust your program. Things change, weather changes, lifestyle changes, but we'll continue to work with you, help you to reach your goals.
Great. Thank you very much.
Great. Well, thank you for watching. Don't forget to subscribe. I'll see you next time. Bye.